Now, when we get to more expensive items like blood work, drawing blood, sending it to a lab, obviously somebody who's in a hospital for a 6-day stay is going to get a lot of blood drawn and get a lot of lab work done. The cost for Sean's lab work, all told, for that 6-day period was $15,000. What would Medicare pay for the same exact volume of blood work and lab work? About $300, $400. So we're talking about not only enormous inflation of pricing, but it's a pricing scheme that is targeting people who don't have insurance and don't have Medicare. If he had quality insurance, the insurance company would be getting a discount from these prices that I'm giving you now. What we have is a hospital system where those who are least able to pay are charged the most. And those who have the most money to pay and have the best insurance, and by the way, also have the most political clout, pay the least. It's an upside-down pricing system, to say the least. So let's look at the second patient that Steve Brill looked at. Her name is Janice. Janice is 64 years old in Stamford, Connecticut. And at dinner time one night, Janice began to experience sharp chest pains. Fearing the worst, she called 911, had an ambulance come pick her up. The ambulance drove her 4 miles to Stamford Hospital. There, she had an experience in the emergency room. That's kind of a typical experience that most of us have had. You have an acute problem, you go to the medical room, you wait around for a while, you spend several hours there. Eventually, you see somebody, they do a battery of tests, you have minimal contact with a doctor, but you do have some. And in Janice's case, they did a workup and discovered that she had not had a heart attack. She had merely had indigestion that she had interpreted as a heart attack. She was given a clean bill of health, sent home happily from the hospital. Happy ending, right? Well, that was until she got the bill. The bill for this 3-hour stay in the hospital was $21,000. That's right, $21,000 for 3 hours in the hospital. So, what kinds of charges were levied against Janice in this situation? First of all, she was charged for something called a troponin test. A troponin test is a test that looks at or that looks for various proteins in your blood, the proteins that are indicative of a heart attack. So these are a good way of determining whether a heart attack has happened or whether it hasn't happened. Sounds like a very appropriate test to do. And they charged her $200 per troponin test. Now, again, I ask, what would Medicare have paid for the same test? The answer, $14, $13.94. Medicare had paid. $200, $14. $200, $14. I mean, you're getting the idea here that these prices that hospitals charge are grossly inflated. And I might add, when I talk about Medicare, Medicare is authorized by Congress to pay hospitals a fair fee for the services rendered. And fair in this context means it has to take into account the cost of the service or the product that the hospital is offering and any associated overhead, salaries, administrative costs, everything that goes into the provision of a troponin test is encompassed in that $20 fee, in this case a $14 fee that the hospital is being reimbursed by Medicare. Now, to be sure, hospitals are always crying poor mouth, and many hospitals are saying, well, you know, we're being underpaid by Medicare. We're losing money as a result of these relatively small Medicare reimbursements. Now, to that I have two things to say. First of all, no hospital is required to take Medicare patients. The fact that they do indicates something to me about the appropriateness of the Medicare payments. They obviously believe there is a profit to be made by taking these patients. Second of all, even if it were true that, as a hospital claims, we're losing 10% on every Medicare patient, suppose you simply jacked up the Medicare price by 10%, 20%. Suppose rather than paying $20 for a chest x-ray, they paid $30. That would be a 50% increase in the price of a chest x-ray. That would still be so far below the rate that's being charged this patient that it's the claim of an insufficient Medicare payment is really irrelevant by the hospital. So a few other charges that Janice incurred during her 3-hour stay. She got a CBC, a complete blood count, cost $157. Medicare would have paid $11 for the same procedure. Now, I should also point out that Steve Brill, the author of the article, was relentless in going to hospital administrators and saying, look, I have a bill here. I need to understand it. Please explain this $157 charge for something that Medicare would have reimbursed you at $11 for. Constantly, as you would expect, he got the brush off. Either the administrator wouldn't talk to him, or they told him that they couldn't speak with him because of HIPAA privacy laws, or they used a phrase that is kind of funny. They said, we can't really explain this particular charge, but it's a historical charge. Well, to me, that's another way of saying we have no idea why we're charging this much, but it's what we've always done, and we reserve the right to keep charging the same amount. He never got an explanation for any of these charges. I mean, the hospitals were relatively shameless in this regard.